all right. If not, please feel free to, as Sonia said, use the chat box to stop us, and we'll try to correct any problems we might be having. As she said, we're going to go step by step through the preparedness and planning tool today. Let's go ahead to the next slide, please. The planning tool is something that we're going to have all of you complete. If you want to be a health home partner, or if you want to subcontract with a health home partner, you need to fill this tool out. You need to send it to me by April 1st if you want to be a health home partner for our launch date of July 1st. Now, you can become a health home partner at any time. Many of you will probably not be quite ready by July 1st, and that's just fine. But keep these dates in mind. If you are shooting for July 1st, try to get it into me by April 1st so that we can give you full consideration. The third bullet point here I'd like to draw your attention to is how you can actually access the tool online. So let's go to the next slide, please. If you go to the main KanCare website, you're going to see under Policies and Reports a link for health homes in KanCare. So you'll click right there. And then this is the main health homes page. So there's a lot of information here. I would really encourage you to look around, look in the consumer section as well, because there might be some useful things you can use with the people you serve. We have frequently asked questions, news and events. But for today's purposes, let's focus on the providers box. So you click on the providers box, and then along the side you'll see these black links. The one that you're going to need is the one that says informational materials for providers. And you'll see the first three bullet points on the screen right now are to do with the preparedness and planning tool that we're going over today. We have two different versions of Microsoft Word. And that's just because not everyone has access to the newest versions, and we want to be sympathetic to that. If you can access it in either version, that's fine. You don't need to send it to me in both versions, just one. And then also the instructions are available as well. This is a good point to also note that just this morning we added a final black link that says webinars. So if you ever want to know what webinars are upcoming, or perhaps go back and revisit today's webinar or another webinar, you can click on that link and we would have all of that information provided for you. So let's go to the next slide, please. So let's talk a little bit about the purpose of the tool. The tool has several purposes. One specific audience that it's designed for is for providers. The other is for the MCOs. So with regard to the providers, we're really hoping that this tool will be a conversation starter. We want it to help you get talking and get thinking about what it would take to become a health home partner. It should help you create a roadmap. So it should help you understand your ability to support progress towards becoming a health home partner. It should help you assess your strengths and your challenges. And most importantly, perhaps, it should help you set and prioritize your goals moving forward. Next slide, please. For the MCOs, this is also a very important document for the MCOs. It will, we hope, assist them in evaluating, supporting, and contracting with the potential health home partners. It's important to note that it's not designed to determine whether a potential health home partner is going to be accepted or rejected. Again, it's a roadmap, it's a conversation starter, it's a baseline to assess where you are and where you need to be. Next slide, please. How to use the tool. It's going to be best if you answer the questions in the tool on an honest assessment of where you are and where you need to be. You'll get no points, so it's not scored, so you can't circle yes and think you're going to be ahead of the game. You need to really think about where you are and try your best to give an honest evaluation. There's some pre-work that would be helpful. If you can collect information about the population you serve currently, how often you serve them, how many people you serve, what do they look like, what are the characteristics they share. Also think about your infrastructure. What does your agency look like? How is it set up? Are there particular factors that make it unique, that would make it uniquely capable of becoming a health home partner and succeeding? We encourage you to have leadership from all levels of the organization involved and discuss the results as a team. If there's not a consensus, that's okay, but again, just start the conversation. And then again, identify your goals and what you're going to do next and how you're going to move forward. Next slide, please. So this is what you will see on the first page of the actual tool. And this is asking about your general population. And number one, we've asked for the most prevalent top 5 diagnoses in the population you serve. So it's important to remember that health homes are not for everyone. We're asking for these diagnoses to gauge whether you are the right kind of fit to become a health home partner. Remember, health homes are for people with serious mental illness and those that have diabetes, asthma, and certain other chronic conditions. So just because you don't have the first 5, diabetes, asthma, serious mental illness, etc., that's okay, but it's useful for the MCOs to know who you serve and who you serve often. Questions 2 and 3 are related to how many people you serve and how often. And I'm not going to hit every line of this tool because that would take a really long time. But I think that this gives you a good idea of the type of information you're going to need to collect before you really get into the meat of the tool.
Yes, I'm going to try to respond to her today.
Next slide, please.
This is Sonia. Samantha, let me just jump in a moment. We're hosting, and I just want to make sure I've heard several more join the call since we began. Everyone's invited to mute your line to make sure that none of your background noise interferes with the call. And for all of you who may be developing questions as we step through the tool, you're invited to ask those questions in the questions box on the right. So we are receiving some of those questions, and keep your questions coming as Samantha steps us through this tool. Thanks so much.
Thank you, Sonia. So now we're going to get into the core services that are going to be provided by health home partners. The first is comprehensive care management. And I know that some of you are very, very familiar with where we are with health homes and what some of these core services are, but some of you aren't. So forgive me while I step back a second and try to drill down into these issues. Some of you may already know this stuff, but if you don't, feel free to ask questions. So comprehensive care management. The way that I would best describe this is you're going to help make a plan to guide the members, their doctors, and their other providers. So question 1 reflects this. Do you provide comprehensive care management through knowledge of the medical and non-medical service delivery system within and outside of the member's area? Yes or no? Question 2, do you provide comprehensive care management through effective cultural, linguistic, and disability-appropriate communication with the member, family members, support persons, guardians, and service providers? Yes or no? And really, comprehensive care management, when you look at these first 2 questions and the whole set of questions, you're going to see, do you have the knowledge to perform this service? Do you have the ability to perform this service across a diverse population? And they're yes or no questions. You may feel like you need to go beyond yes or no and explain yourself, and that's fine. I do ask for examples later on in the tool, and if you need to attach additional documents, that's fine. We encourage more rather than less information at this point. So next slide, please. This box you're going to see repeated time and time again, and that's because it's important. And as I said when I first picked up the phone, even if you're just planning on subcontracting for 1 or 2 of the core services, you need to fill out this tool. Say that you are wanting to be a health home partner, but you know that you're going to have to work with someone. You're going to have to subcontract for some of these services. This is where you're going to tell us about your plans for subcontracting. And you'll notice the second line down, if you're subcontracting for this service, you need to attach appropriate documentation. So do you have, formalized paperwork that shows exactly who is going to be doing what? And if not, that's fine. But if you could at least tell me, we've been in conversation with provider X. We've talked to a leadership at provider Y. Let us know that you are pursuing this and where you really see yourself going forward with the subcontractors that you intend to work with. The final two boxes where it says score. Again, this isn't a score to judge you on. This is a self-assessment. So 0 to 10, how ready are you right now? And in the final box, what are your greatest obstacles that you would need to overcome in order to improve? So feel free to tell me here. Maybe you need extra staff. Maybe you need training for the staff you have. Whatever it might be, go ahead and let us know so that we can work with the MCOs to see if this is something that we can help you overcome. Next slide, please. So the second core service, care coordination. Again, stepping back how we would explain this, it's making sure that the members are getting the right services at the right time. Now, obviously, it's a little more in-depth than that, but for those of you that are just starting, think of it in those terms. So question 1, do you provide care coordination that is timely, addresses needs, improves chronic conditions, and assists in the attainment of the member's goals? Yes or no? Question number 2, do you provide care coordination that supports adherence to treatment recommendations, engages members in chronic condition self-care, and encourages continued participation in health home care? Yes or no? And again, thinking back to what I said, right services at the right time. So let's think about an example here. Perhaps there's a diabetic that you're working with whose doctor says they have a need to see an eye specialist. Follow-up should obviously be quickly, and the health home partner should ensure that it's timely and that it happens and that all follow-up care is taken care of. So I hope that makes sense. Let's go on to the next slide. And again, as I said before, you're going to see this box repeated over and over again. Please take the time to fill it out each time. If you're not subcontracting for this, that's okay. Just answer no. But if you are, again, provide us the information that we need to see where you are. And let's go to the next slide, please. Third core service is health promotion. And this is just teaching your members about their conditions and how they can help themselves be healthier. Questions 1 through 5 are going to drill down into that a little bit more deeply. So question 1, do you provide health promotion that encourages and supports healthy ideas and behavior with the goal of motivating members to successfully monitor and manage their health? Yes or no? And so an example here could be, you've got, let's stick with the diabetic member, someone who is diabetic. Perhaps you need to tell them about healthy eating habits, tell them about some good recipes that would help them. Perhaps you need to put them in contact with someone who can help them get on an exercise plan. Things like that. And questions 1 through 5 should help you assess if you're ready to do this kind of work. Next slide, please. Again, the subcontracting and scoring slide. Just remember to fill this out every time for me. Next slide, please. Comprehensive transitional care. So how I would explain this is it's going to help the members when they're discharged from a hospital or care facility. Now, obviously, it's a little more intensive than that, but that's a good place to start if you're not familiar. So question 1, do you provide comprehensive transitional care timeframes related to appointments and discharge paperwork? Question 2, do you provide comprehensive transitional care follow-up appointment information? Yes or no? So we know that follow-up care is important when someone is leaving, let's say, the hospital. And we also know that if you don't take care of yourself when you leave the hospital, you're likely to wind up back in the hospital. And we want to prevent that. So one of the things that we're hoping that the health home partners can do is help make that transition as smooth and successful as possible. And that's what we're trying to get at here. Next slide, please. Again, I'm sure you're getting tired of this slide, but please fill it out for me when you come to it in the tool. So next slide, please.
Can you guys still see it? This is there.
Member and family support. Excuse me. So this is really about, do you provide the member and their family support? And I think it's important to focus on communication here. Are you going to help them reach their health goals by working with their family, their other providers, and all caregivers involved. So question 1 reflects that. Do you provide member and family support that is contingent on effective communication with family members, guardians, and other support persons or caregivers? Yes or no? Do you provide member and family support that involve accommodations related to culture, disability, language, race, socioeconomic background, and non-traditional family relationships? Yes or no? And so I think on this one, the important thing to recognize is that we have a great deal of diversity in some of the groups that we work with. And we want to be sensitive to that, and we want to make sure that communication is happening in an effective way. Can you provide these services? And questions 1 through 6 will walk you through that. Next slide, please. And again, the subcontracting slide. Thank you. The final core service is referral to community and social support services. And this is making sure that the member gets the other services and supports that they need to stay in their home and be successful and be as healthy as they can be. So question 1, you provide referral to community and social supports through knowledge of the medical and non-medical service delivery system within and outside of the member's area. Yes or no? You provide referral to community and social supports through engagement with community and social supports. Yes or no? And so this, I think, if you're going to focus on 2 things, focus on knowledge and engagement. Perhaps you have a list of community resources that you can direct your members to, or that you can work with other providers who are working with this member so that they know everything that's available to them. So next slide, please. Again, contracting and scoring. Thank you.
Sam, this is Sonia again. And Sam, if I could just pause for a
Mhm.
moment. As we transition from the 6 core services and move forward, there's someone with a cough who can mute their line. That would be really helpful. And just a reminder to everyone, make sure we have our lines on mute. Thanks.
Thank you, Sonia. So health, home, information technology. And I know we're using some acronyms here, so bear with us. We're really asking, do you have an interoperable electronic health record that you're using? And it's okay if you answer no. Questions 1 through 3 below are going to just kind of gauge where you are and help the MCOs know what they need to do to help you move forward. So question 1, do you currently have the capacity to submit a plan within 90 days of contracting as a health home partner to implement the EHR? So we're just asking, do you have a plan? Can you commit to making a plan within 90 days of contracting, yes or no? Question 2, the state expects health home partners to achieve full implementation of the EHR within a timeline approved by the lead entity. Provide an estimate of how long it may take you to meet this expectation. And then we're going to allow you to circle 12 months, 18 months, 24 months. So think about this in an honest way. How long is it going to take? And what do you need to get there? Question 3, the state expects health home partners to have the capacity to connect to one of the certified state health information exchanges. So we have KanCare or Lacey, and then provide us an estimate of how long it would take you to meet this expectation. And again, you're circling the time frame that you think most closely aligns with your capacity right now. So next slide, please. Health home provider standards. I'm not going to work through each and every one of these. You can probably read a lot faster than I can talk. But I'll give you the broad strokes here. Health home providers must meet state licensing standards or Medicaid provider certification and enrollment requirements as one of the following. Do you meet these standards? And you might circle no to most of these. You might circle yes to most of these. But please go through carefully and select the appropriate response. Next slide, please. Sticking with health home provider standards, health home providers must enroll or be enrolled in the KanCare program and agree to comply with all KanCare program requirements. Are you enrolled in the KanCare program? Yes or no? Do you agree to comply with all KanCare program requirements? Sonia, we're having some sort of emergency in our building.
Okay.
I'm going to continue on until Becky tells me to stop. But I apologize if you can hear our emergency siren sounding.
We're concerned foremost for your safety, Samantha.
I'm sorry?
We're concerned foremost for your safety. So if you need to go, let us know. We'll continue without you. But I hear that alarm, and it's not that loud.
Okay. We'll try to get through this. I'm sorry, everyone. Question 3. Household partners must have strong, engaged leadership who agree to participate in learning activities, including in-person sessions and regularly scheduled calls. Does your leadership fit this description? Yes or no? And then give us some examples. So let's go on to the next slide, please. Household partners must have the capacity to accompany enrollees to critical appointments when necessary to assist in achieving health action plan goals. And do you have this capacity? Yes or no? So you kind of get the idea here. These are all yes or no questions. We do ask for brief examples, and we hope that you'll provide those, again, either in the boxes or in attached documents. So next slide, please. So this is the household partner and lead entity joint standard. Again, I'm not going to hit every one of them, but I do want to point out just a few. So question 1, the lead entity and the household partner jointly must provide 24-hour, 7 days a week availability of information and emergency consultation services to enrollees. Do you have staff and procedures in place to ensure this availability? Yes or no? And then the other questions in this section are similar. Again, yes or no questions. Some ask for examples, and we ask that you provide those where they're asked. Next slide, please. This is just more of the same. So again, more yes or no questions. If you've got specific questions about these, I'll be happy to circle back, but we want to make sure we have time to get through the tool and have questions, so let's move on for now. This is an important one, and I do want to read through a little of this. The lead entity and the household partner jointly must demonstrate their ability to perform each of the following functional requirements. Can you do the following? Please provide a brief example to support your answer to each. If you respond no, please explain where you are in your process and describe your current abilities. So I think it's very important to note that it's okay to say no, but please tell us where you are and what it would take to move forward. So question 1, coordinate and provide access to high-quality healthcare services, including recovery services informed by evidence-based clinical practice guidelines. Yes or no? So can you provide these services, number 1, but you might also want to tell us about the clinical practice guidelines that you're using so that everyone is kind of on the same page about what you're doing and why. So let's go on to the next slide, please. This is just question 7, kind of flowed over into the next slide. That's my presentation for now. Again, I apologize about the alarm sounding. I hope it's not too distracting. If anyone has questions, I'm happy to take them now, but I'm going to turn it back over to Sonia, and I believe she is going to introduce the MCO representatives as well. So thank you, everyone.
Thank you, Samantha, and thank you to the handful of questions that we have in the queue so far. On the line today, we have with us Leslie Banning from AmeriGroup, who can also assist with answering some of the questions you might have. And we have Dr. Friedebach, and I apologize if I'm not pronouncing your last name correctly. I'll get that soon, from Sunflower State Health Plan. And I'm not sure if we have Ben Pierce on the line from United, and if you're there, you can let me know. We're thankful for everyone that can be here to help answer questions. We just have a few, so if you have a question that you have on your mind, I encourage you to type it into the text box because several of those questions might be helpful to your peers. The first questions are about the very beginning of the tool. And the question says, do you want to know individuals seen in the target population, or all by the agency. So for that first page of the tool, related to their 5 diagnoses and the total number of encounters, et cetera, is that just within the target population, or is it the entire group by the agency? And that probably is a question back to you, Samantha.
All right, this is Samantha. We want your whole agency. We want to know the whole population you're serving. And again, you might not list anywhere in the top 5, someone with, let's say, asthma. But that's okay. Tell us about the people you're serving right now. And think about if you're willing to expand your service base as well. So I hope that answers your questions. But again, always feel free to send me an email or contact me directly, and I'll be happy to go into more detail if that's needed.
And another question read, how do community mental health centers determine all the primary care diagnoses in our catchment area? And so I'm wondering if that's an interpretation of those first 5 diagnoses question, and is that clarification of the first 5 diagnoses within one's own population or within the catchment area itself? So Samantha, as I read the tool, my assumption is that you're asking for the top 5 diagnoses within the agency's population. Did we lose Samantha?
Can you hear me? I'm very sorry. We've got this alarm going off and things are kind of getting screwy. You're correct in your assumption. It is for the diagnoses for your agency.
Okay, and one more from the first page related to questions 2 and 3. Is that the total clients served or just those who would qualify as a health home client? You're wanting the data about...
We're asking for the total clients served. Now, if you're able to break it down, again, more information is better than less, but we're asking for the total client base that you're serving right now.
Okay, so we have a couple of other questions. One is, define substance use disorder provider. So that was one of the yes or no boxes on that long list of providers. So what constitutes a substance use disorder provider?
So what I need to do here is refer you to the website, ask you to look in the state plan amendment that's located under informational materials for providers. We also have documents that say provider requirements, provider standards. These are things that we have defined in other places. Some of this is very lengthy, so I'm not going to be able to give you a verbatim definition right now. But go ahead and look at those other documents. Look at the state plan amendment. And if you still have questions, give me a call, and I'll be happy to work you through it, okay?
Excellent. Thank you, Samantha. Another question that we have is related to so related to diagnoses, those top 5 diagnoses, do you want those grouped? So as, for example, all depression diagnoses together rather than separated out by various variations?
Okay. I've just been handed a note that I need to evacuate.
Okay.
So, Sonia, I'm going to have to hand it over to you. I'm very sorry, everyone. I'm really not sure what's happening here at Speak-Up, but I'm very sorry.
No,
please
fine.
contact me directly if you have questions. Sonia, I'm going to give it back to you, okay?
Okay. Pass back to me. We're happy to take those answers. So again, for those of you who joined the call perhaps a little bit later, this is Sonia Armbruster at the Center for Community Support and Research, and we are helping host these webinars. And this was certainly an interesting, unforeseen circumstance. But we are capturing questions on the website that will be answered, and those answers will be posted on the KanCare website within our health homes. And for all of you who are registered on the call, we'll be sending the answers to those questions. There's a question on the call that asks, when can we get an idea of payment rates? And we have planned for this call just to answer questions about the preparedness and planning tool. There is some information about rates available on the website now, but those are the dollars that KDHE will be paying per member per month in the SMI spa with to the KanCare providers, to the 3 MCOs. So in a future call, we'll have additional information about the answers to the payment rates. I just want to acknowledge we received that question. Another question was mentioning that subcontractors must fill out the application. If we're going to subcontract with an agency that is contracting with the MCO for prevention services only, the tool does not seem to apply. So that is a great question, and the answer is answer each of those questions as fully as is appropriate for you. So for example, if you are considering providing health promotion services only, then you would simply answer no to the other 5, the other 5 of the 6 core areas. So it's not an application. It's a tool for beginning a conversation between the individual health home provider partner and the MCO who they will be subcontracting with. If you want to advance the next slide. Just wanted to announce that we're saving the date for the other topics that we're planning to provide an overview for. So the other topics that will be coming up next week, we'll be talking about the program manual and some of the other documents. Many of those documents you can see on the website now. March 18th, we'll be talking about member assignment and the referral process. And March 25th, the payment structures for the 2 spas. April 22nd, the health action plan step-by-step, and April 29th, HIT. Another question that's come in, where can we get details on what it means to have an interoperable EHR? I believe that is defined in a document on the website now, and we will have the clear answer for that posted on with the answers to all of the questions from today's webinar, unless there's an MCO rep on the call who would like to take an answer for that. Again, the question was, what's the definition of an interoperable EHR? So for the 2 MCOs that I know are registered and on the call, a similar question that has been asked is, I assume the MCOs have an EHR. Will it be the preference of the MCO that the health home partner use their EHR? Would either of you be willing to comment on that? Is there a preference related to EHRs?
Hi, this is Dr. Friedebach, and I think the answer to that question is evolving. I think at this point, the MCOs are pretty aligned, and we want to optimize health information technology where it's available, and that's probably in some ways going to be health home partner specific. So if a health home partner doesn't have an EHR but would benefit from using one of the MCO portals, then that may be a starting point that we evolve from. So I think the health information technology utilization question is one that probably allows us to define where our starting point is and how we may evolve and transform from there. But to my knowledge, there hasn't been a definite direction on what that needs to look like from day one.
This is Bill Down with United. Ben is out today, but I'll take this. We, as Dr. Friedebach mentioned, we also are evolving in the way we're going to approach this. We do have a web-based platform that could be used as we are using it, in the process of using it in some other types of circumstances. I don't know that we would necessarily require that our platform be used, and that's part of what's evolving to make sure that we can track the appropriate information. So as we meet with the providers, those would be discussions that we would have and create whatever opportunity might be effective to help in managing the information.
Thank you both for that bit of clarification there, that this is an evolving process and that there will be additional information coming forward related to those 2 things. Okay. This is the majority of the questions that have been asked. There are a couple of others that are going to be Samantha specific, and I'm sure she'd be very happy to answer them if they hadn't evacuated the building. So we will get the answers as quickly as possible. The answers, the webinar itself will be posted online on KanCare's website either later today or tomorrow. For any of your colleagues who have not have not been on the line, if you have any specific questions, we encourage you to direct them to Samantha Forensic, and her email address is on the screen right now. And she'll be happy to help answer any questions. Thank you all for being on the call. In about an hour, you're going to get an evaluation, and we encourage you to fill that out so that we can help develop a better webinar for the next time. Thanks so much.